Here's what needs to happen.
Okay.
Oh. All right, you're on.
Okay, great. So again, thanks so much, guys. I'm going to do a quick talk about vascular technology, and yeah, if you could make sure that you can see the screen and stuff.
Oh.
You can get even closer if you want, because that way you can just cut the top.
The lights need to adjust.
So
Here's what needs to happen.
what I'm going to talk about is basically
you're on.
a unique Doppler.
So again,
device
thanks so
called,
much, guys.
micro Doppler developed by Vascular Technology Incorporated. There's a few different applications that this Doppler can be used for, and it really makes a difference when it comes to microsurgical applications. So, for example, this is an example of using the micro Doppler for partial nephrectomy
Can you see what
cases.
I'm doing?
So, partial
Hold it so I can
nephrectomy
see this TV. And
is basically
you hold it like
a
that.
case where we cut out
You have the keys?
kidney tumors and try to make sure that we're minimizing blood loss during the case. So one of the problems is when we the kidney is very vascularized. There's about 2 or 3 liters of blood passing through the kidney per minute. So when we do a tumor removal, classically when you just try to do a partial nephrectomy or remove just the kidney tumor, you have to clamp the kidney to stop the blood flow through the kidney, through the tumor, or through the kidney to make sure that we don't lose a lot of blood when we cut that tumor out. So what we do is we clamp the vessels, and what we're using the micro Doppler for here is basically to make sure that the blood supply has been clamped out, that there's no accessory arteries, so we haven't missed the small tributary artery that's going to the kidney, while we're preparing to do the partial nephrectomy. So it comes in really handy to make sure that we're not missing any additional vessels in the area. And so this is a very helpful kind of application of the Doppler. This is, again, used for robotic renal surgery. And again, this is where we're using Doppler to kind of assess where the vessels are. So sometimes when you're doing dissection in difficult areas of the kidney, island is scarred in, it's very helpful to know where the artery and vein are. So this micro Doppler device, if you use it as such shown in the video here, you can use it to detect where the artery and vein is in a lot of tissue, and so makes the dissection very much simpler and helps guide the surgeon so we don't inadvertently injure the artery or vein. Again, a very useful tool from that standpoint. Another use is unique use is by, for example, Dr. Philip Livermore from the University of Strasbourg. And he does some very unique work with plastics and reconstruction work. And this is a patient who had a knee injury and had a few surgeries on her knee, and unfortunately had scarring forming, so she had to have a redo of the surgery. And when we went in to look at when he went in to do the dissection, it was very difficult to identify the arteries and veins. So these are the arteries and veins behind the knee, and he's dissecting these out with the robot, but using the micro Doppler to assist in identifying where the arteries and veins are. And so again, a really unique application of the vascular Doppler to ensure that surgeons don't make a mistake and we minimize any risk to the patient. Finally, at the Pure Clinic, where myself and Dr. Brombett are from, we use the micro Doppler tremendously in robotic-assisted microsurgery. So, for example, when we're doing varicocectomy surgery, we'll do special dissection through the cord to identify, open up the cord, and then we use the micro Doppler, like here, to identify what's an artery and vein. A varicocele is a congenital anomaly where you can have excess veins around the testicle. And so it can cause infertility issues, low testosterone, can cause pain. And so one of the treatments for that is to ligate these veins up in the subinguinal area. And so what you're looking at here is basically we've made a small incision, brought up the spermatic cord, and we're tying off these veins. Now this is magnified about 15 to 20 times. So you can imagine these are very, very small structures that we're working with. The VTI Doppler allows us to detect or assess small arteries and veins down to even about 1 millimeter in size. So again, a very, very powerful tool in the surgeon's repertoire of different applications for these probes. Now what's the future? The company's working on some ultra micro Dopplers, so getting down to vessels less than 1 millimeter in size. And so this is just a coin of a nickel sitting next to the probe, just to give you an idea of how small these probes are. They're quite tiny. So Can be quite impressive, and makes doing surgery on these areas much easier. So again, just wanted to give you kind of a brief overview of some new technology that we use for robotic-assisted microsurgery, intra-abdominal robotic surgery, laparoscopic surgery. Has a lot of applications, and quite an innovative little device that helps us tremendously in these fine procedures. So again, thanks for your time, and we'll probably be signing off at this point, and then Dr. Brambach will probably be coming back on probably in about half an hour to 45 minutes with some of our web talks during the drive. So again, thanks so much, guys, for staying out, and please stay tuned, and we'll be back soon. Thanks. Bye-bye.
You now bring to that table.
Man, I'm not doing well.
You're big like that.
Look at that.
I go around the other side, and then you won't be right.
Oh.
You're not avocado on this?
Yeah.
Right. We're gonna.
What's interesting, and what we're seeing is just this consistent, which is that leading piece into your cardiovascular disease. And it has a lot to do with, as teenagers and younger people, not eating right, nutrition issues, not exercising like you were used to, and that's showing up in heart attacks in 30s, heart attacks in early 40s. And we're just seeing that across the board.
So it's the same thing you hear that we've been talking about adults not doing that they should be doing for years. Now it's affecting younger people.
Absolutely.
Because we're all adopting these lifestyles.
Absolutely. The other issue is diabetes is projected to increase 10 to 15 times in the next several years. So that's another piece of it. So we have so many symptoms that come into cardiovascular disease: sleep apnea, erectile dysfunction, which Dr. Lucky was talking about. Periodontal disease is actually a symptom. Anything that's dealing with blood flow and any signs of reduced or restricted blood flow. Okay, it's pumped up here. So what we're going to do now is we're going to pressurize this non-dominant arm, and we're going to shut the blood flow off to that brachial artery. Now it's going to tingle a little bit. It's going to feel like your arm's going to sleep, but at the cost of not doing it something invasively, this is really the hardest part of the test. So as we can see on the screen, we've shut your blood flow off. So the straight line now we're backing it up because we're going to create a shear force event to that brachial artery. We're going to make something happen to it, and we're going to test how well it reacts. So we'll do that for 5 minutes.
Right. It was good. It just so.
One of the pieces, Yada was talking about treatment pads. There's a lot of different things that a physician can do depending upon your particular case. If you have diabetes, if you have a family history of cardiovascular disease. Some neat thing is red yeast lice, which is a natural statin. Some people don't like to take statins. There's some things there. So we have a chemical situation. If we have dysfunction, it's breaking down chemically. So we're going to be able to replenish those natural chemical components of the endothelium, and that's a real nice way to be able to solve this problem.
But I don't know about. I'm sorry. It's 4100. I didn't know what you're asking. I was distracted by my
What's that?
I got caught up in my own heartbeat.
Sorry to keep you starving.
That's quite all right. There happen to be many establishments in the surrounding area that I promise you I will have no problem
So you guys
finding food
halfway
after this.
feel really bad.
Dude, don't feel it. We're good. I'm gonna go across the street and get a sandwich. So,
How much longer is left?
We've got about, I'd say, 6 minutes.
Oh, perfect. Okay. We're gonna start wrapping up here.
Oh yeah, it's starting to tickle now.
It's going to feel like it's falling asleep.
Yeah, I really feel it.
what we're doing and the test in the general public, this thing has kind of been at a cardiology level, and are using the test with diabetic patients, urologists for their ED patients for that connection. And I want to be clear here, not as a screening tool, because it's much more. This test, once it's completed and it has to go to a specialist, they're going to be able to derive a treatment path.
Sure, right.
And that's a huge distinction.
I get that.
Okay, about another minute and a half and release.
And how far away is the test results?
Immediate.
Oh, wow.
We'll be able to generate, the software will generate that number immediately.
And so, in ideal conditions, for good or for bad, we would just send this over to my physician.
We would actually do it. What
You
we
would
would
do-
do
yeah,
is we
okay.
would give you a report at
Yep.
the time of test, and then we would send that report to your physician,
Yep.
and we would have a consult with that doctor.
Sure.
Because, quite frankly, it's just getting into the primary care community. So we would have a consult with them. We would explain what's going on. We would tell them the treatment path. And a great deal of this does have to do with lifestyle modification. You know, you're doing something wrong. So you want to get an engagement with the physician in a way that if it's a smoking issue, if it's exercise, nutrition, there needs to be a plan. And that's why this is being used as a baseline test. So that 12 months from now, we're going to take this test again. And we're going to say, okay, are you getting better or are you getting worse? Even if you're in a normal condition, you can still see it moving one way or the other, which could, again, let you know what's happening before there will be an issue.
Right. And to have a 12 months later be able to do a kind of test against the benchmarks of that.
Correct. You're creating your own benchmark.
Yeah. And again, 15 minutes, no invasive, and you're good.
You got it.
Yeah.
All right, about another 30 seconds.
I can see it still attached.
Okay.
Aaron? Aaron, what do you guys do? I'm coming with you.
What you'll see now is that blood is hitting the artery. It's coming back in, and you'll start to see that waveform get a little bit larger, a little bit larger. What's happening right now is a reactive hyperemia, which means that brachial artery is reacting to that blood. So you can almost compare that to the outside of both of the walls.
Yeah.
So we'll do 5 minutes of nothing.
Did you really need to watch it, dude? Watch it happen.
Aaron, I'm going to have you start recording. I'm going to have you start recording. Aaron, when you finish with the results, just get attitude of say something. Things. If there is something, what he's going to do.
Positive?
Don't know yet. Know in about 3 minutes. Well, again, this isn't pristine. You would do this in a room temperature, calm state, no noise. It'd be almost.
Us not stressing about him not being hungry. Oh, eventually we'll do like Burger King or something.
Oh, I will take care of it. Don't
Don't
worry.
do that. Go get a healthy veg sub. Man. Come on, don't go to
I
Burger
feel
King.
bad, man. I feel bad. We just divided. We were very selfish.
Oh, you're
Don't do
fine,
that
guys.
to
You're
us.
fine. I'd rather everyone else enjoy it. That's good. I can take care of it. You're good. Don't worry about it.
That's the I'm annoyed, but me and Cindy are partners in crap. I want to come see you guys. Oh, sure, man. Yeah, for sure.
I do business at Pain by down over there.
Yeah,
and
come on, man.
we got some things that we're doing this in different disciplines, wellness programs. We're having a lot of success right now. It's getting a lot of success. I got the numbers on our books for companies, benefits, the claims benefits, knocking that CBD situation down.
Bobby, do you need to pack anything up?
We're just gonna throw the last remaining things in the car. We're good.
What is it?
No, just whatever's in front of the car. We're good.
Hey, do you need that thing right here? Hey guys.
Is that a live on Twitter? Or?
It's live, yeah. It's live, but I want him to pack up that chair.
Oh, yeah. All right, we got 2 minutes.
2 minutes. 2 minutes. Yes.
Is he awesome? Dude, Bobby, you're famous, man.
I am. This is it
Bobby's
for me.
famous and
Endopat.
I think he has multiple girlfriends, but right now he's single.
Yeah. Look at those looks.
On the
Look at
webcast,
this
I'm
guy.
always single. Come
Look
on
at
now.
those
This is why you're looking at it. This is
No makeup,
men's
nothing, man.
health at its finest.
Well, we're gonna see in a minute here, won't we?
This is
Bobby-
GQ at its
Bobby
finest.
Wesley. Actually,
Hey, we're gonna find out if he's looking good on the
did
inside.
you know
right.
that
It's
the
very
this
intimidating.
high-end
They say
magazine in
numbers like,
Orlando
oh, you're
had this
1.8,
spread
you're
about the
1.6.
5 most. Did you guys know this? The 5 most eligible bachelors in Orlando, and Bobby Wesley was one of them.
I was front and center.
Wow,
Yeah.
congratulations.
Front
Yeah,
and center.
that's
Front
right.
and center.
You can follow me on Twitter. It's at Bobby Wesley. Yeah.
He writes maybe once a month, but he does write
That's
stuff.
fine. That's fine.
All right, 1 more minute.
Yeah, you never know.
Yeah,
That's
hey.
right. That's right.
We'll just. Oh,
But
we
in a
lost
year,
signal.
we can make him better, and
Oh, we lost signal, man. That's what we're gonna say. Hey, but where is the
yes.
Where's the hot?
Yeah.
Okay.
Orlando. Yeah. I've been studying for this test all day. You've never in your life heard that,
Well,
have you?
you are
Never
you're
won
taking
that.
something that not too many folks have had a chance to take yet, so you're on the cutting edge stuff.
Yeah, this is very cool to see.
We're all anxiously awaiting to see what these
I know.
results show.
You're all captivated by my heartbeat.
But
I know.
I think those are
Tell
good
'em.
spikes, right?
Those spikes are from all of this, from all of us talking.
Oh,
It's so
really?
sensitive
All right.
that,
Well, Bobby's sensitive too.
I am very
see how when I popped it
Ladies.
with my finger? I mean, it's so sensitive. That's why you normally do it in a very quiet setting. So this will either be a false positive or a false negative.
Stop thinking about those girls, Bobby.
I know. Well, Dr. B brought him up.
Okay.
And the moment of truth, Bobby Wesley
All right.
is.
Is he
Release?
good to go? Is he
We're
die
gonna
within
find
the-
out in about 12 seconds
All
here.
right.
All right.
Sounds good.
10,
So what we can do?
9, 8,
What does that mean?
4,
Okay.
Not
3,
healthy.
2, 1.
What's healthy?
Okay. What we've got. Here's where we did the occlusion and shut it off. This was the reactive hyperemia. We are measuring this portion to get here. We get a 1.6.
Oh, healthy! All right, let's go. We're going, Sidro. Let's go.
All right.
Technically, you are healthy.
Okay,
You are
technically.
on this number is
Okay.
on the borderline.
Okay.
This number
Let's go.
is significant. Thank
Let's
you
go.
for including us in this.
So I should.
Sidro.
Have Cjo's laptop?